What if your body was already trying to warn you about diabetes, but you were looking in the wrong place? Most people think high blood sugar starts with thirst, fatigue, or abnormal blood tests. But after more than 20 years seeing older patients in my office, I can tell you something almost no one explains clearly. In many people, the first signs appear in the feet. Yes, in the feet. Tingling at night, burning as if you were walking on fire, heels that crack for no reason, cold feet even under the blankets, a small wound that takes weeks to close. And the problem is that most people ignore them because they seem like normal aches and pains of aging. But sometimes they are not. Sometimes they are silent signs that sugar has been damaging nerves, blood vessels, and circulation for years without making a sound. Today, I am going to show you the 9 signs in the feet that worry me most as a doctor, and why many can appear years before a formal diagnosis. And believe me, you have probably felt one of them at some point, without imagining what it could really mean. Let us start with sign number 1, and I want you to pay close attention because it is something almost all my patients have felt at some point, although each describes it differently. Tingling, numbness, that uncomfortable feeling of feet falling asleep. Many people tell me, "Doctor, I thought it was because I felt sick, or surely it was from crossing my legs too long." And yes, that can happen occasionally. But when that feeling appears over and over again, without a clear reason, that is when we need to look deeper. Frequent tingling or recurring numbness in the feet, what we in medicine call peripheral neuropathy, can be one of the first signs that your sugar has been high for quite some time. And the most dangerous part is that it usually advances silently. Excess glucose slowly begins to damage the protective coating of the nerves. It is a slow, almost invisible process, and that is exactly why so many people ignore it for years. I always try to explain it with a simple image. Imagine your nerves are like electrical wires. Each wire has a protective cover around it that allows the signal to travel correctly from the brain to the feet. But when sugar stays high for too long, it is as if a corrosive substance is slowly wearing away that protection. The wire keeps working for a while, yes, but the signals start to fail. And that small failure is exactly the tingling many people feel before understanding what is really happening. According to the American Diabetes Association, peripheral neuropathy affects almost half of the people with diabetes, and in most cases, starts exactly in the feet. That is why I always give the same recommendation to my patients over 60 years old. Walk every day for 20 to 30 minutes. You do not need to run. Walking can already help a lot to keep circulation active and protect those nerve endings that work tirelessly. And there is something else you must start doing today, not next month. Reduce added sugar in your diet. Because every day with elevated glucose levels is another day of silent wear and tear on your nerves. Now I want to talk to you about sign number 2. And honestly, this is usually the most distressing one for many patients, because it does not appear amid the noise of the day. It appears at night, when everything is quiet and the person is trying to sleep. I am talking about that burning in the soles of the feet, that sensation of intense heat, as if the feet were burning from the inside. Many attribute it to fatigue, the summer heat, or having spent too many hours standing. And sometimes it really can be that. But when someone tells me they feel their feet burning, especially when going to bed, I take it very seriously. Because nighttime burning in the feet is a classic early sign of diabetic neuropathy. What happens is that the damaged nerves start sending wrong signals to the brain. The brain interprets heat even though nothing hot is touching the foot. It is like a fire alarm with a broken sensor. The building is not burning, but the alarm keeps sounding because the system is damaged. And the same thing can happen inside your nervous system. The burning does not come from the outside. It comes from injured nerves that have been trying to withstand the damage caused by excess sugar for a long time. Research published in the journal Diabetes Care found that burning pain in the feet can appear 1 to 3 years before a formal diagnosis of type 2 diabetes. The body often warns before the disease is completely discovered. That is why I recommend 2 very simple but very important habits. First, maintain good hydration. Drinking at least 8 glasses of water a day can help the kidneys better eliminate excess glucose and support the functioning of nerve tissue. Second, increase fiber in every meal. Vegetables, beans, and oatmeal. Fiber helps slow down the absorption of sugar in the blood and that can be a major relief for nerves that have been under pressure for too long.
Sign number 3. And here I need you to pay close attention, because this sign stops being just uncomfortable and starts becoming something truly dangerous. This is one of the most frequent reasons why many patients end up in the emergency room. They arrive worried and tell me, "Doctor, I got a small blister from my shoe weeks ago, and it still has not healed." They waited. They thought it would close on its own. And normally many small wounds do, but not always when sugar remains high for too long. When blood glucose remains constantly high, the body begins to lose part of its ability to repair tissues. The small blood vessels, especially those reaching down to the feet, slowly begin to narrow and harden, and that causes a silent problem. The oxygen, defenses, and nutrients that help close a wound no longer arrive fast enough. The skin remains open, fragile, trying to heal much more slowly than normal. I always try to explain it with a very simple image. Imagine a garden that needs water to stay alive, but the hose has a tight knot in the middle. The water still exists, yes, but it cannot reach where it is needed. That is exactly what happens with circulation when high sugar begins to damage the blood vessels in the feet. And here appears the real danger that many people underestimate. A small wound that remains open too long can become the gateway for a serious infection. The Centers for Disease Control and Prevention have pointed out that diabetic foot ulcers continue to be one of the leading causes of non-traumatic lower extremity amputations in the United States, with more than 100,000 cases a year. And on many occasions, everything started with a scrape, a blister, or a small cut that seemed insignificant. That is why I want to ask you for something very simple tonight after your bath. Sit down for a few minutes and look at your feet calmly. Look between your toes. Check your heels. See if there are blisters, cuts, cracks, or areas of broken skin. Because often the body warns in silence, and most never look at that part of their body until a major problem appears. If you find any lesion, wash it with mild soap and water, use an appropriate antiseptic, and protect it. And if it does not improve in 48 hours or gets worse, consult your doctor. Not next week, not when you have time. The sooner it is checked, the better the chances of avoiding major complications. Now let us move to sign number 4. And this is one of the most deceptive because it is hidden in plain sight. Many people look at it every day without realizing what it really means. I am talking about color changes in the skin, especially around the ankles. Many patients tell me, "I have always had that darker area," or "I thought it was from the sun." And sometimes it can be true. But there is a specific pattern of coloration that we usually monitor when we suspect problems related to high sugar and circulation. When blood stops reaching the legs and feet correctly, the skin begins to reflect it. A darker, reddish, or even bluish tone can appear around the ankles. It is the body's way of showing that this area is not receiving enough oxygen-rich blood. I always tell my patients to imagine the blood as a delivery truck carrying oxygen and nutrients throughout the body. And the feet are at the end of the longest route. They are the last stop on the trip. When the roads begin to narrow due to damage in the blood vessels, those deliveries arrive late or stop arriving normally. And the skin, deprived of fresh oxygen, begins to change color like a silent distress signal. A study published in the Journal of the American Academy of Dermatology found that these skin changes could be detected on average up to 18 months before a formal diabetes diagnosis. In other words, the skin often starts talking before the tests do. That is why I recommend something very simple every morning. Dedicate 5 minutes to move your ankles, raise your toes, and gently stretch your calves. It seems like a small thing, but that movement helps activate circulation to the legs and feet. And for people who have difficulty walking or exercising, even slightly elevating the legs while sitting can help more than they imagine. Sign 5. And I want you to listen to this very carefully, because many people think this symptom only has to do with fatigue or age, when in reality, it may also be speaking of something much deeper, the kidneys. I am talking about frequent swelling in the feet and ankles, especially when removing your socks leaves deep marks on your skin at the end of the day. Many patients tell me, "Doctor, surely it is because I sat for too many hours, or I spent all day on my feet." And it is true. Occasional swelling after a long day can happen. That does not always mean a serious problem. But when the ankles remain constantly swollen, when the sock marks seem to sink into the skin every night, then the body could be sending an important signal
that should not be ignored.
High sugar for years does not only affect the nerves and circulation, it can also slowly affect the kidneys, which are the great filtration system of the body. They are like a water purification plant working tirelessly day and night. All the blood passes through them to be cleaned. But when excess glucose begins to damage those delicate filters, the system loses efficiency and the body begins to retain fluids. And here gravity comes into play. Excess fluid tends to accumulate in the lowest part of the body, the feet and ankles. That swelling, which in medicine we call edema, can be a sign that the body is having difficulty maintaining the normal balance of fluids. I always try to explain it to my patients like this. Imagine that the drainage system of a city slowly begins to clog. The water does not disappear, it accumulates. Exactly that can happen when the kidneys no longer filter as effectively as before. And one of the first areas where it is often noticed is around the ankles. There is a detail that especially worries me when examining a patient. If you gently press the swollen area with a finger and the mark remains for a few seconds before disappearing, that can indicate what we know as pitting edema. It does not automatically mean something serious, but it is a sign that deserves medical attention, especially if it appears persistently or worsens over time. The National Kidney Foundation reports that diabetic nephropathy affects approximately 1 in 3 adults with diabetes. And the most delicate thing is that the deterioration often begins silently, long before obvious symptoms appear. That is why I recommend small habits that can help a lot. When you rest, try to elevate your legs slightly above the level of your heart, even if it is just using a pillow. That simple gesture can encourage the return of fluids and relieve pressure on the ankles. And there is another very important step. Reduce excess sodium. Salt promotes fluid retention and can worsen edema. Many people believe they only need to avoid adding salt to their plate, but much of the sodium is hidden in processed, canned, and prepared foods. That is why it is worth starting to read labels more carefully. And if you notice that the swelling is new, appears frequently, or is slowly getting worse, do not wait too long to mention it to your doctor. Sometimes the body whispers before it screams, and listening to those signals in time can make a huge difference in the coming years of your health. Sign number 6. And honestly, this is usually one of the ones that surprises my patients the most because it seems totally harmless. In fact, many people live with this for years without imagining it could be related to blood sugar. They tell me, "Doctor, my heels always crack in winter. It is just dry skin." And yes, dry skin is something very common, especially with age. But the situation changes when those cracks appear even in summer, when the heels keep breaking even if you use lotion every day, or when the skin seems unable to recover its natural moisture. That is when we begin to suspect the problem may come from deeper inside. Diabetes does not only affect circulation or the nerves that produce pain and tingling. It can also affect the autonomic nerves, those that control automatic body functions we almost never think about. One of them is the ability of the skin to maintain its natural moisture and regulate sweating. When those nerves begin to get damaged, the sweat glands in the feet stop working properly, and little by little the skin begins to dry from the inside out. Many people believe the problem is only on the surface, but in reality, the body is losing its natural ability to protect the skin. I always explain it with a very simple image. Imagine a brick wall. The skin is that wall, and the natural moisture works like the material that holds the bricks together. When the autonomic nerves are damaged, that support slowly begins to break down. Then the cracks appear. And here's the real problem many people do not know. Deep cracks in the heels are not just an aesthetic issue. They are small open doors for bacteria and fungi. And when poor circulation exists, a seemingly small infection can advance much faster than normal. The American Podiatric Medical Association has noted that chronic and hard-to-treat cracks in the heels can appear as part of autonomic neuropathy in older adults, especially when sugar levels have remained high for a long time. That is why I recommend something very simple but very important. Moisturize your feet every night before sleep. A good moisturizing lotion or even pure coconut oil can help protect the skin on the heels and soles of the feet. But here's a detail I never want you to forget. You should not apply lotion between your toes. The moisture trapped in that area promotes fungal infections, especially in people with diabetes or compromised circulation. And there is another habit that seems small, but is not. Drink enough water during the day. The skin needs hydration from the outside, yes, but also from the inside. 8 glasses of water a day can help much more than most imagine. And I want to pause for a moment here, because we have already gone through several important signs together. I want to ask you something with complete sincerity. Have you noticed any of these signs in yourself or in someone you love? Maybe in your spouse, in your parents, in a sibling, or even a close friend. If the answer is yes, even if it is just a single sign, I would like you to write it in the comments. I personally read the messages from this community because this channel was born precisely for that, so that older adults feel accompanied, heard, and better informed about their health. And if this video is helping you look at your body with new eyes, hit the like button. Sometimes such a small gesture can make this information reach another person over 60 who needs to hear it right on time. Let us keep walking together in this process. Sign number 7, and this is one of the signs most often confused with normal problems of aging, especially in older men. Many people spend years living with this pain without imagining the origin could be in the nerves and not in the bones or joints. I am talking about that intense, shooting pain, sometimes like an electric shock in the foot, especially during the night. Many patients tell me, "Doctor, I thought it was arthritis or an old injury." And yes, sometimes it can be. But in other people, something different happens. When sugar remains high for a long time, nerves can begin to send exaggerated and disorganized signals that the brain interprets as real pain. Some describe hot needles piercing the foot. Others feel sudden pricks or electric shocks that appear without warning. And they almost always worsen at night, when the silence makes the body hear itself more clearly. I always try to explain it with a simple image. Imagine a car alarm that was damaged after a small bump. No one is stealing the car, but the alarm keeps sounding because the system was altered. The same thing can happen with an injured nerve. It sends alarm signals even though there is no new injury. And here lies the problem. Many people spend months trying to calm the pain without understanding what is really causing it. Ibuprofen can relieve some discomfort for a few hours, but it does not repair a damaged nerve. Research published in the New England Journal of Medicine has noted that painful diabetic neuropathy is frequently confused with arthritis or age-related pain. That is why I recommend something simple before you get out of bed. Take a few minutes to slowly move your feet and ankles. Make gentle circles and flex your toes. That small habit can help activate circulation before starting the day. Now let us move to sign number 8. And when I see this sign in consultation, I know that often the problem is no longer in such an early stage. I am talking about constantly cold feet, even when the weather is warm. Many patients smile and say, "Doctor, I always had cold feet." But then I ask an important question. Even in summer? Even under several blankets? Because that is when I really start to worry. When the feet stay cold regardless of the temperature, that can indicate that circulation to the legs and feet is compromised. The blood vessels begin to narrow, and warm blood stops reaching the extremities properly. Think of the circulatory system like the heating pipes in a house. If the pipes get blocked, the heat stops reaching the furthest rooms. Something similar can happen in the feet when circulation has been slowly deteriorating for years. The American Heart Association notes that peripheral artery disease is common in people with diabetes and can seriously affect the legs and feet. And here the best tool is still movement. Walking daily, even if it is only for 10 minutes, can help tremendously to stimulate circulation. The important thing is to start and maintain consistency. And now we reach sign number 9. Honestly, this is one of the most silent and least known. Many people never relate it to high blood sugar. I am talking about hair loss on the feet and lower legs. During some exams, I notice there is practically no hair left in those areas. The patient is surprised and says, "I had never noticed." And that is exactly the problem. It is a discrete sign that is easy to ignore. Hair follicles need constant blood and oxygen to stay active. But when circulation slowly deteriorates over the years, those small follicles stop receiving enough nutrition, and little by little, the hair stops growing. I always compare it to small plants in a garden. As long as the water arrives correctly, the plants keep growing. But when the pipe begins to block, growth stops slowly and almost without making a sound. Some research found an important relationship between hair loss on the legs and peripheral vascular disease in people with diabetes. That is why I want to ask you something simple when this video ends. Look closely at your legs and the tops of your feet. See if the hair has become much thinner or if it has practically disappeared in certain areas. And if you notice clear changes, consider bringing it up with your doctor and getting a glucose check. Often the body leaves signs long before more serious problems appear. And I want to end this video by telling you something very important from the heart. If you have noticed several of these signs in your feet, do not ignore them thinking it is normal for your age. The body often speaks in a low voice before it screams. A glucose test, a medical checkup, or a timely consultation can make a huge difference in the coming years of your life. Do not wait until the pain is unbearable or a serious complication appears to act. My personal advice, after so many years seeing older patients, is this. The sooner you discover a problem, the more chances you have to protect your independence, your mobility, and your quality of life. And remember something fundamental. All the information in this video is for educational and guidance purposes. It should never replace the evaluation, diagnosis, or treatment of a health professional. Your body deserves attention, listening, and timely care.